So obviously we're going to start with the maturation in the womb. As you know, those 9 months are crucial because it is the physiology of a baby that's being created. And it's not like it's just a physiology inside the physiology of the mother. There's a lot of elements that influence how that baby is going to be created, how it's going to mature. And that's why you're going to start going very fast and telling me what are those important elements that are going to ensure that that little cell is going to become a human being with all the possibilities of growing as a full human being later. In utero. Wendy, you first. Fast? What are the important elements that will ensure that this baby will grow up harmoniously and well inside the womb?
The mother is in a very calm state.
Nutrition.
Nutrition, more than one word. Good, bad, adequate.
Good nutrition.
Good nutrition. Okay, so calm, peaceful environment for the mother.
Yes.
Okay.
And good nutrition, and that's got to come by the mother too.
Absolutely.
A lack of no drugs or alcohol.
No drugs, no alcohol in the mother. Why is that, guys?
Well, alcohol, you get fetal alcohol syndrome.
It goes, exactly. It goes
Brain
into,
injury.
exactly. And it goes into the baby via the cord, obviously. Everything that happens to the mother is represented in that physiology of the baby.
So freedom from any physical trauma or injury.
Yes,
to the mother or to the fetus.
absolutely. I'll talk about another day about a friend of mine whose mother was expecting her when the mother had a car accident. And it's changed my friend's life forever. Get on.
It's important that the mother is happy.
Yes, why is that?
Because if she's not, she can start releasing cortisol, and it will affect the way the baby develops.
Right. And do you know anything about the sexuality in the womb? I think you do. We talked about it.
Right.
Yes?
Yeah, that a high level of stress hormones could change or could have an impact on, let's say, on the full maturation of the sexual orientation.
Exactly. It can actually change the balance, the hormonal balance that will actually later on affect the propensity, affect some of the direction. It will create some vulnerability on one way or the other into the baby, which is why some children are born actually homosexual. And so people say, well, it starts, it's genetic. No, it's not. Well, maybe it is in some ways. I don't think there's enough research corroborating that. But certainly stress hormone affect the later sexuality in babies. Mark?
That the baby is wanted?
The baby is wanted. And you all say that's absolutely. You guys have gone back to that in any of your feelings? No? How do you know then? You say this with great gusto, but then I can't get anything to back it up.
So when we were born, we've all experienced not being wanted, and so we realised that we need to be wanted right from the start.
You're right. There's many elements to that, obviously. There is the physiological element, then there is the emotional element, and then later on, if you're not wanted, you'll know. But until you know, you don't know in an intellectual level. You know on other levels. How do you know on other levels? Yes, Ken?
Well, it has to do with what your needs are and what you didn't get. I know that by feeling what I didn't get. And that specifically one of the things that I didn't get was being held by my father, which seemed so simple, such an easy thing to do, but yet it just wasn't there.
Right. So one day it comes together, although it's repressed probably in your unconscious, that you're not wanted, but it's there. Mm-hmm. Your system registers that you're not wanted. There's other ways that the baby knows, quote, that it's not wanted is if the mother is not careful during pregnancy. A mother who doesn't care about her baby is not going to take the time or organize her life in the way that she will be completely focused on the fact that she wants to give that child the full benefit of everything she can do right for him or her, which is what we just talked about, the nutrition, the calmness, having a serene life, having a balanced diet, making sure she sleeps enough, that she exercises enough, that she's not stressed out, that she lives in a good environment, that, you know, all those elements that are transmitted to the child that will be very important on the onset. And when mother does not want the child, I had a patient who said, she said all her life, she, by the way, she was an incredible smoker and she was having a very hard time quitting, even in therapy. And she said, I need to live in a toxic environment. That was one of her insights. And she said, I have always lived in a toxic environment, which was a brother who was shooting darts on her face. She has like, her mother was screaming mother, father was nuts. I mean, the whole thing was pretty bad. But what was very interesting is that she kept saying it without really knowing where it was going. And I didn't know where it was going either, until she went back to her birth. And we have the film of that, and maybe one day she'll authorize us to use those films. And her mother tried to abort her. And so she received the toxicity of the attempted abortion. And so but it's interesting because she said, all my life I've always said, oh, this is toxic, I can't stay here. And it went all the way back down to the abortion attempt by her mother. So obviously a toxic environment is registered by the baby. You know, the most primitive cells react to their environment. So obviously a 9-month organism reacts also to an environment. So this is really important. Womb life is super important. Sometimes I feel like I should have dedicated my life to fighting for good birth. Because although there's been some great pioneers that have talked about birth and the importance of birth and what is right to do in birth, it is a lifelong work. And I hope someone will do it one day. Are you all familiar with Dr. Le Boyer, the French? Yes? Okay. What Le Boyer, and there is a book here so that you can, you know, if you're interested, you can look at it. What Le Boyer found out, and his book is about, is the fact that when babies were born, the first thing we do to them is put them in atrocious pain. The room has glaring lights. People don't care about the noise they make. The room is usually very cold, for a septic reason, but nevertheless. And then the baby is yanked out, and the first thing we do to that little creature who's been warm and cozy all his life is take it upside down and, you know, slap him as fast and as far as we can. You didn't have that done to you, Jürgen?
I don't know. Still I can't remember.
So birth is actually extremely traumatic in the way we perform it in the world. But it's also it can be very traumatic inside. And to us, that's really where it goes. A lot of it goes back to when we have birth primals. If for any reason the baby cannot be born, as you know now, who gives the signal of birth? The baby. Because the baby does what? It's saying, 9 months, not 1 more minute, ready to go. Sends the hormones to his mother. That starts the mother's hormone, that starts the birth process. It's the baby that says, ready to go and see the world. So if that does not happen in the right way, if the baby is slowed down, and you know, as you know, it's better now, but for many, many years, once they discovered anesthesia, you know, births were happening a lot with the anesthesia mask, and the mother was blissfully falling into complete, what do you call that? Oblivion, thank you. And meanwhile, the anesthetic was going into the baby's system through the umbilical cord, which is 40 times more powerful for the baby than for the mother. And if the mother is out cold, you can imagine what it did to the baby.